Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, we hear again about new research from the team at the Novel Coronavirus Research Compendium, which is available online at ncrc.jhsph.edu. Our topic is reinfection with the novel coronavirus. First, we'll hear from Dr. Cherie Schwartz, an epidemiologist at Johns Hopkins, about a paper on reinfections in a single Kentucky nursing home. Then, we'll hear from Henri Garrison Desanet, a doctoral student in epidemiology at Johns Hopkins, about two papers, one published in The Lancet from Denmark and one in the Journal of Infection from Brazil. Let's listen. Dr. Cherie Schwartz, thank you so much for joining the podcast again today to talk about the data on reinfections. Where should we start?
Thanks, Josh, for having me back. So we're still learning a lot about reinfection overall, and particularly we also have an interest in thinking about reinfection in vulnerable populations. So I'll be talking about a study that uses data from the Kentucky Department of Health that looked at reinfections in a single nursing home in Kentucky.
So that's particularly important because of the high risk of nursing home residents for serious illness and death. And it's a big question whether people who have been infected once are at risk for reinfection, and if they are at risk for reinfection, whether they could get seriously ill again.
Exactly. And this is critical because we know that the elderly are vulnerable to more severe outcomes. And we also know that individuals who live in congregate living spaces are more likely to be exposed to infections. So together, that makes this an important question.
So what did the Kentucky Department of Public Health do to evaluate it?
So basically, what they were working with within this facility were two COVID-19 outbreaks. So the first one was in mid-July, lasting through mid-August, in which they had 20 of their 115 residents with coronavirus infection. So about 17% were infected. That first time around, 8 of those individuals were hospitalized, of which 5 died. Then they went through 2 months in which they had no positive tests, and they were doing routine testing. So everyone had at least 4 negative tests. But then come the end of October through early December, they had a second outbreak. And this one was really quite large. So 2.5 to 3 months later, 85 of their 114 residents, so 75%, were infected, and of those, 15 died. Now, we have these 2 outbreaks, and now we're thinking about reinfection. So just coming full circle here, of those who were infected the first time and still at the facility, still alive, there were 12 of those individuals. 5 of those 12 were reinfected, so over 40%.
Wait, so of the people who were infected the first time, who were still there, 40% of them got infected just a couple months later.
Yes, that's correct.
And how sick did they get?
So in all 5 of these cases, the individuals initially had an asymptomatic or mild infection. And the second time around, for all 5 of them, they had more severe cases. Now, they weren't all, hospitalized, but in each case, it was more severe. And in fact, one of those 5 individuals, unfortunately, did die.
Wow, that's terrible to hear. And it's such a high rate of a severe second infection. So mild infection the first time, severe infection the second time. What about people who might have had a severe infection the first time?
Yeah, well, it's a little bit difficult to say because they didn't exactly do that analysis. But what I can say is that of those 8 that were hospitalized the first time, 5 of those individuals unfortunately died. So there were only 3 that had extremely severe infections the first time that were still alive. And none of them became sick again. I will note that in these cases of reinfection, just to clarify, they weren't necessarily all extremely severe, right? But they were more severe than the first time, including the one death.
Got it. And so did this study look into any of the details for how these reinfections happen? Were they different strains? Were they for people who didn't have antibody responses the first time? Any more information about why people would get sick again, even sicker, just a few months later?
Yeah, that's a good question. And it's one of the limitations of the study is they didn't have any samples stored, so they couldn't compare sequences. They couldn't look at the antibody response from the first infection. So we really don't know, did these individuals have an antibody response and then it waned? Or did they never develop an antibody response because the infection was more mild the first time around? We do know that none of them had, severely compromised immune systems or were on suppressive medication, but we don't have a good understanding of exactly what happened to the first infection and how that impacted the secondary infection.
Certainly seems to support the recommendation for people who may have been infected before to be vaccinated.
Absolutely. These data really highlight the importance of vaccination, particularly in settings like this, and really just remind us of the importance of diligence. And we still don't know what's going to happen as new strains begin to, continue to take over and circulate in the country. And this, was really done before these new strains were circulating. So things could certainly get worse and really speak to the importance of vaccination.
Great. Thanks so much for joining.
Thank you.
Henri Garrison-Desanet, thank you very much for joining the podcast to talk about some data on reinfection. We're going to talk about two papers. Where do you want to start?
Thanks so much. I'm excited to be here today. I think I'm going to start with the paper out of Denmark. This study was really interesting. It's observational, looking at basically everyone who was tested in the country during their first surge from March to June in 2020, and their second surge from September to December 2020. So they've got over 500,000 people in this study, following them over time to look at reinfection.
Wow, so they must have quite a national health system to capture all this data.
Yes, they were able to link into a number of different testing sites, and they noted that offering, free testing for everyone really made it possible to have this type of follow-up.
Okay, I want to hear what happened. What did they find?
So of those over 500,000 people kind of in the study, in the first surge, they had 2% who were testing positive initially. And then of that, 2%, 0.7% went on to test positive in the second surge. Compared to people who were testing negative in the first surge, about 3% of them later tested positive in the second surge. So kind of comparing these two groups, they found that prior infection had about an 80% protection from later infection in the second surge.
Interesting. And just so that I'm totally clear, if I were in Denmark and I had gotten infected during that first surge, and you were in Denmark and didn't get infected during that first surge, then everything else being equal, I would have an 80% less chance of getting infected the second time.
Yes. Mm-hmm.
Got it. And did they look at how severe the infections were?
So they weren't able to get too much into severity, but they were able to kind of stratify this out by age group and a few other sociodemographics. So one interesting thing they also found was that this protection seems to wane with increased age. So we were talking about 80% in the larger population, but for older individuals 65 and up, it's more like 47%.
So compared to younger people, older people were less likely to be protected by their first infection.
Yes. Based on these results, it definitely looks like that there's less of that protection among older people, whereas younger people, you're talking upwards of that 80%.
So what didn't the paper cover that you wish they'd been able to include?
So because this is observational, while they calculated that protection in a similar way you would calculate vaccine effectiveness protection, we can't actually determine if that's based off of antibodies or some biological response, or if it's based off of different lifestyle changes people may have made. So people who were infected earlier in that first surge, are they using masks and socially distancing the same amount that people who were not infected in that first surge? Or are they being more cautious? Are they being less cautious? It's hard to kind of interpret exactly how much of that protection is due to some biological response versus those more social distancing factors we've been seeing.
Got it. So the take home maybe isn't the very specific numbers that you're talking about, but the general concept that it looks like that first infection provides some protection, but not complete protection.
Yes. Mm-hmm.
Great. Thanks so much. So on to the second paper. Where are we headed?
Great. So for this one, we're going to Brazil, and we're looking at recurrent symptomatic COVID cases among healthcare workers. So people who were infected, they recovered, and they later tested positive again. And we're comparing those recurrent cases with controls who are only infected once to look for differences in severity of infection and antibody responses.
Great. So we have two groups of healthcare workers. One group got infected twice and one got infected once.
Yes. And we're looking at 33 who were infected twice versus about 62 individuals who were only infected once.
Great. So let's talk about the people who were infected twice in their first infection compared to the people who were just infected once. Were there any differences that the authors noted between those groups?
Yes. So they saw in their antibody testing that people who were infected twice, after that first infection, they had a lower antibody response compared to people who were infected once. After their first infection, they had a higher antibody response in comparison.
So that suggests, maybe doesn't totally prove, but it suggests that it might be possible to measure an antibody response that could correlate with immunity.
Potentially. They didn't necessarily do that comparison, but it's pretty noticeable that there's this seeming drop-off.
And then the people who went on to get sick again, they had a lower antibody response the first time, and then they got sick. What happened to them?
Yeah, in that second infection, compared to people with a first infection, they saw more symptoms, some more severity, basically. And they didn't necessarily have the numbers to do a deep dive on this, but for people with recurrent infection, there were about 4 hospitalizations and 1 person actually died during their second infection, compared to people with a first infection where there were no hospitalizations, no deaths.
Interesting. So that second infection turned out to be more severe for people who had that first infection, maybe didn't mount such an antibody response.
Yes, that's what the evidence is pointing to.
Now, did they look at the particular strains of coronavirus to know whether this had to do with, for example, the Brazilian, variant that people have talked about?
They were only able to do genetic testing on 2 samples among the recurrent cases. And of those 2 samples, only one of them they had data from their first infection and from their second infection. So in that, one sample, obviously we're dealing with the smallest number you could have to do this analysis. So many caveats here, but there is evidence that it is different comparing the strains. And some of those spike mutations that you may have heard about, there is evidence of those as well present. So they didn't necessarily test for, very specific variants, but kind of looking at the genetic lineage of these, it seems like this is reinfection from different strains.
Got it. So they found a different strain. So this may suggest that people who have milder infections or less immunogenic infections that first time might be vulnerable to more severe infections, particularly from variant strains.
Mm-hmm. It's particularly concerning if this holds true in the larger population with all the different variants, of course, that are coming up in the US and many other countries as well.
Sounds like another good case for vaccination. What do you think?
Oh, definitely. One prior infection is simply not going to give you the same protective levels as if you actually got vaccinated. And of course, there are discussions around different variants, but evidence to date at least suggests that a vaccine truly is your best shot to protect against those as well.
Great. Well, thank you so much for joining me. This has been fascinating.
Not at all. Thanks for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.